Alright guys, so we're looking at what do they call it? Hemostasis, then thrombosis. That could actually be a complication in pregnancy. Alright, hemostasis. Come. Alright. So hemostasis just simply means, well, it's blood clotting, right? Then thrombosis, of course. Thrombosis is a complication of hemostasis. That's abnormal blood clotting. Alright. So these things could actually be complications in pregnancy. Yes. So for these two, we're saying that during pregnancy, the body undergoes changes in what? The whole clotting system. Alright. Aiming to minimize what? Blood loss during delivery. So but this can actually increase the risk of what? Thrombosis. So if the system is not properly being managed, it can now tilt the body into what? Abnormal clot formation. You understand the whole thing? So the physiological changes is hypercoagulability. Generally in pregnancy, the ability of blood clots to form, or blood clot form more easily. You understand? Blood clots forms more easily. There's increased clotting factors, right? So levels of what? Several clotting factors increase during pregnancy. There's decreased anticoagulants. Level of some natural anticoagulant like protein S decrease. There's reduced what? Fibrinolysis, like breakdown of fibrin is reduced. Okay, so a lot of fibrin can accumulate and form clots. Okay, so you see how we're saying. So what we have here is this. Okay, you can just pause here and be looking at this. I just want to send something through email to somebody. Well, let's be going through. Pregnancy is associated with what? Hypercoagulability. There's increased risk of what? Thromboembolism. Right? There's an increase in what? Plasma factors. Like others in factor what? 7. Right? Others than factor 7, factor 8, factor 10, and fibrinogen in pregnancy. There's shortening of what? Prothrombin time. Alright, and also the activated platelet thromboplastin time. That means the time is shortened. It's easy for clots to form. You get? Breakdown of fibrin is suppressed. Fibrinolysis is suppressed. So these changes may persist till 2 months after delivery. There's also increased incidence of thrombosis during this period. Alright. There's an association between what? Thrombophilia in pregnancy and recurrent fetal loss. Alright. So this is presumed to result from placental thrombosis and what? Infarction. Alright. So this is why. Okay. Reasons why there will be what? Hemostasis and thrombosis in pregnancy. Because the body is what? Preparing itself so that it will now stop a lot of blood loss when it's eventually pregnancy time.